Welcome, and thank you for taking the time to watch this demonstration on meaningful use, how to achieve the core and menu measures. This video demonstration will be on core measure number 10, documenting clinical quality measures. Let's get started. First, let's open up the Clinical Quality Measures PDF from the MTBC website. Here we have the Eligible Professional Meaningful Use Core Measure number 10, Report Ambulatory Clinical Quality Measures to CMS. Now before we dig into the details, you may remember a program called PQRI, which was the Physicians Quality Reporting Initiative that was launched in 2008. The Physicians Quality Reporting Initiative was a program that allows physicians to submit quality measures to Medicare and earn a bonus for the submission of those measures. That program has now been included as part of meaningful use, and physicians who are interested in earning meaningful use are required to successfully submit these measures. The measure here is to successfully report to CMS ambulatory clinical quality measures selected by CMS and in the manner specified by CMS. Now this is a little bit vague, frankly, because the PQRI measures have already been documented and spelled out in detail. And as vendors of EHR software, we have been required to certify that our software is able to submit and generate the clinical quality measure information. And there are no exclusions for this measure. The attestation requirements here are simply yes and no, but there are some additional attestation information that we've seen recently released on the Medicare website. And so we'll cover a few of those attestation requirements as well. First, let's go to the EMR and learn more about what are these clinical quality measures and how can they be completed through the EMR. In the EMR, during the course of the normal clinical documentation, where you may be documenting patients' diagnosis codes and procedures, immunizations, allergies, medications, and many other clinical criteria, in the background, the EMR is keeping track of your clinical quality measures, and it can help you submit those measures to CMS for the requirement of core measure number 10. One of the functions of the EMR is to also provide you reporting on those measures. If you go to the Reports menu and go down to the option called Clinical Measure Reporting, you can open up a list of all of the available clinical measure reports that can be generated through the EMR. And here we can see the list of all of the reports that are available. So there are 9 clinical measures that are available, including 2 for tobacco screening, which is preventative care and screening. So let's just begin with the first one, adult weight screening and follow-up. Now, what is the rule for adult weight screening and follow-up? Well, if we're documenting BMI information for our patients, the EMR will keep track of what percentage of those patients have a BMI that falls outside of a normal range. And it will also keep track if a follow-up plan is documented for those patients. For the preventative care and screening for influenza patients, the EMR will also keep track of those results. How many of your patients have received a flu vaccine for this year? For diabetic patients, there are 3 clinical measures that you must provide reporting on, including A1C control, low density lipoprotein control, and blood pressure management. For example, if you have a patient who has diabetes, CMS would like to know what percentage of your patients have their blood pressure under control. Similarly, for hypertension, blood pressure management is important. For childhood immunization status, there are a whole series of immunizations for which the EMR can provide detailed reporting on what percentage of your patients have met their immunization requirements in the time frames specified by CMS. For preventative care and screening of tobacco use, a tobacco use assessment, and tobacco use cessation, you must provide reporting on these two items to CMS as well. And finally, weight assessment and counseling for children and adolescents. The EMR can automatically provide a BMI tracking for your patients. So let's take a look at adult weight screening and follow-up and take a look at the results. First, we must select our provider and select our time frame. We'll keep it for this year and click search. The EMR will now provide us the numerator and denominator that we need in order to meet this requirement. The way these numbers are populated is through the use of algorithms specific to PQRI measure number 128, adult weight screening and follow-up, and those details can be found on the MTBC website. Clicking on the patient detail option will show us all of the patients for whom we've met the requirement and the single patient for whom we have not met this requirement. During the Medicare attestation, you will have to provide this numerator and denominator field for submission and for attestation to meet this requirement for adult weight screening and follow-up. If we take a look at the attestation pages on the Medicare submission website, we'll find that there is a tobacco use assessment option for PQRI and the NQF point number 28, where we must provide a denominator and a numerator for our tobacco use assessment. And here it's for the percentage of patients aged 18 years and older who have been seen for at least 2 office visits and were queried about tobacco use 1 or more times within the 24 months. And then Part B, which is tobacco cessation intervention, we will have to provide the denominator and numerator that has been populated by the MTBC EMR. To meet this meaningful use requirement, you will have to populate this material for your diabetic patients, hypertensive patients, childhood immunization status, weight assessment, all of the available requirements for your practice. If, for example, you're an internist that does not see patients, you're excluded from the option to report on childhood immunization status. However, if you have diabetic and hypertensive patients, then you must provide the PQRI reporting for the diabetes and hypertension patients.